Good morning. My name is Bassem Gohar, and I'm an adjunct professor with the University of Guelph in the Psychology Department, as well as Laurentian University School of Human Kinetics, as well as a faculty researcher with the Center for Research in Occupational Safety and Health. I'm truly honored to be here today to this virtual conference with the Public Services Health and Safety Association. I hope you're all doing well during these unprecedented times, and I hope everyone is keeping safe, and hopefully things readjust sooner than later. I'll be talking to you today about basically sickness absenteeism in the workplace. This has been an area of mine for quite some time now, area of research, I should say. So for the last probably 6 or 7 years, that's the area that I've been focusing on, is sickness absenteeism in the healthcare system, with a focus on nurses and healthcare aides, or PSWs. So I will share my screen now. So just a quick disclosure. All the information that you see on here are based on research. They're not based on any psychological advice. So as a clinical psychologist, I'm just giving that full disclosure there. None of this should be perceived as psychological advice. To my knowledge, there's no known conflict of interest. And also, you will notice, as I kind of alluded to earlier, that I'm going to be talking about healthcare at first, but I will start focusing more and more on nurses and healthcare aides, because that's what my research has been about. So the coronavirus has affected everybody to some capacity. So some quick stats for Ontario as of June 11th, there has been over 31,000 cases that have been confirmed. What's surprising is that almost 17% of those are healthcare workers. So this is, I would think, is a little bit high and also concerning given the possibility of further spreads. There have been 319 outbreaks in long-term care homes, 150 outbreaks in retirement homes, and finally 86 outbreaks in hospitals. So it goes without saying the impact of the coronavirus when a healthcare worker goes on leave is quite significant. So it's going to affect the way that service delivery is being handled. It's also going to increase the costs related to absenteeism. It's quite costly when one nurse or healthcare aide, for example, goes on leave. There's got to be a replacement, and you know, if the if the leave is for extended period of time, then there's more costs associated. With that, it's going to leave staff short. It's going to increase the work demand. It's going to, by that, we're going to increase the risk of infections. We're going to increase the risk of physical injuries, because you might be doing double the work, for example. And you're also increasing the work stress as well as the possibility of job burnout. So I put the stop sign here just as a visual, because this is not necessarily something new. This is not something that just happened because of the coronavirus. The outcomes that I was just talking about have been ongoing for quite some time in the healthcare field, with a focus in nurses and healthcare aides. So let's talk about some statistics. So healthcare workers have the highest number of illnesses and injury rates and sickness absences compared to other sectors in Canada. So nurses and healthcare aides are basically the highest. So from healthcare to nurses and healthcare aides. So here's a quick visual to depict that. So for example, the annual illness or injury rate is about 6% when we look at the average of all the sectors. But when we look at the healthcare, it's 8%. And when we zoom in a little bit more, it goes up to 10% for nurses and healthcare aides. Similarly, if you look at the next column, you'll see that the annual sickness absent rate for a year is about 7 days. You look at healthcare, it's almost 12%. Then when you zoom in a bit more, it's almost 2 weeks. So it's basically the nurses and healthcare aides combined, they are double the average for all sectors. So this is quite concerning. What's even more concerning is that there is a projected shortage of almost 60,000 nurses by 2022. This will, and to add to that, there's also a high job turnover rates and intent to leave. So even those who may not be hurt or sick, because of the demands within the job, they are thinking of leaving the workplace. There's also low job satisfaction. And when we try to look at factors that help us predict sickness absenteeism, we see that there's a lot of conflicting findings. So what my research was for the last few years was to help identify the factors associated with sickness absenteeism in the nursing population. So to predict helps us to prevent. If we know what the issues are, we can prepare for it. That's my hypothesis there. My second objective is understand the why. So the what is great, but if I don't know the why behind it, it may not be as helpful. So these are my two objectives that I have looked at for the last few years. And just so you know, what I mean by sickness absenteeism here is basically any report of physical and or psychological reasons. So if someone hurts themselves, if someone is feeling ill, if someone is having like poor, whether it's from a trauma or depression, burnout, if they cannot attend to work for these reasons, that's pretty much considered sickness absence. So in order to carry out my study, I used a mixed methods, and it's actually an evidence-based approach, and I'll talk about that in a second. So in terms of quantitative, so using numbers, I did a meta-analysis. So a meta-analysis is basically a systematic review. So I examined the entire literature as much as I can, and I used the statistics in there for predictors to help me understand the overall effects of each predictor that I can find. So as I mentioned before, there's conflicting findings. So as an example, one study might say that increased age could increase the likelihood of sickness absenteeism, while another study says it does not. So the meta-analysis helped me to basically quantify all of these in a statistical way to help me determine the magnitude, so how much it's going to affect, and also an overall effect. So this will help reduce the conflicting findings, as I mentioned. I also did qualitative work, and the qualitative work is really interesting, and it helps to basically discuss these lived experiences with the people who I'm interested in learning more about. So they really help me understand the why, okay? So it helped me understand if there's any other factors that maybe I didn't see in the literature, as well as to help me understand why does sickness absenteeism occur the way that it does. So the approach that I have used basically for this is an evidence-based approach. So evaluating external evidence, and that basically is the meta-analysis. So the external evidence is what else is out there, and meta-analysis is considered to be one of the stronger designs to determine evidence. I've also looked at context and local evidence. So I spoke to nurses and healthcare aides and key informants from Ontario. So I'm getting some more local evidence. Practitioners' judgments and stakeholders, this is basically speaking to those nurses and PSWs and key informants and learning about what they basically have to say and any sort of guidance on where to go next. So here's basically my first slide for results. So this is a Prisma chart, and it helps to basically explain the results that I found in my meta-analysis and the studies that have been included. So my literature search started with almost 1,500 basically results or studies that I had to funnel through. 812 of those were duplicates, and then by the end, as I kept basically clearing more and more, because I have to look for quality work. So it's not necessarily just anything that looked at sickness absence. It had to answer specific questions, and the studies had to basically be of quality based on tools that I have used to determine quality. So in total, starting from 1481 studies to 27 studies. So here's an example of what we call a forest plot. So a forest plot basically lists all the studies that have been included to look at one specific predictor. So as an example, this one is a forest plot for musculoskeletal pain or musculoskeletal disorders. So all these studies here examined musculoskeletal disorders, and they gave an effect size or an odds ratio of what the likelihood of someone being on sick leave or going or being absent from the workplace due to some sickness because of musculoskeletal pain. Basically, the effect size or odds ratio of 1 means there's no effect. The lower it gets, that means there's less likelihood of experiencing sickness absenteeism. And as it goes higher, it means that there is a greater chance. So if you take a look at this example in particular, a nurse or a healthcare aide that is experiencing some form of musculoskeletal pain is 2.4 times likely to go on a sick leave. In the interest of time, I won't be able to show a forest plot for all the results, but what I did here is I basically outlined them all. All the ones that are in yellow basically indicate that there's some significance. So whether you're having mental health concerns, whether it's anxiety or depression, almost 1.6 times likely to go on a sick leave. If you're a healthcare aide, so a PSW, you'll notice that the odds of going on a sick leave is stronger than those who are nurses. The effect is not very big, but it is still an effect nonetheless. Going on basically working night shifts increases your odds. Also, when we look at different units within a hospital, for example, so those who are working in pediatrics or in a psychiatric facility, their risk increases. Those who are experience fatigue, so fatigue here is physical and emotional, also increases the odds quite a bit. When you're experiencing high demand, so when you feel like your job is getting more demanding and you're unable to adhere to it, that also increases the odds. Now, when you experience or when you perceive your workplace as a supportive work environment, it significantly reduces your odds of going on a sick leave. So this is, if there's any take-home message from this presentation, this is a very, very powerful finding that indicates that if you are in a supportive work environment, you are less likely to go on a leave. This is really, really important for managers, policymakers, and researchers to consider. I was able to, there was enough data to look at the reciprocal or the inverse of that. And obviously low work support increases your odds of going on sick leave. More results for you. Oh, just an FYI, if you see redness, that basically means that the studies where basically there's some heterogeneity, so you kind of have to interpret the results with some caution, but I'll talk about that a little bit more. So basically, female nursing staff had greater odds of experiencing sickness absenteeism than their male counterparts. Now, I would like to emphasize here that based on some of extra research that I have done and even through my clinical work, that doesn't necessarily mean that females themselves as a sex or as a gender are at greater risk. It's actually, from what I have learned, it's not necessarily the sex or the gender, but it's more the personality with reporting. As an example, when we look at depression, so literature on depression, what we'll see is that female patients are more likely to report depression much earlier than their male counterparts. That doesn't mean that male participants or male patients don't get depression, but they tend to report depression much, much later when it's more chronic. And we're suspecting that the same thing is happening here. So they're not necessarily reporting things unless it's very, very debilitating. We found that one's rating of their health is also a predictor, but there is some variability there. So interpret these results with caution. Also, this is very powerful. As a psychologist, this is important to me when I'm looking at risk. The history of something is a strong predictor of future. So if you have been on a sick leave before, you're 3.35 times likely to go on another sick leave. And as I mentioned before, musculoskeletal pain is high. Now, if that musculoskeletal pain is back pain, your odds are very high. They're also 3 times the odds of going on a sick leave. So this is really important results, and I hope that you find these helpful. Some of them might not necessarily be, you know, an aha moment. This might be things that be like, well, we already knew this, but once you see it in numbers, it adds some value to it, especially when we look at the magnitude of it as per the odds ratios. Now I'll talk to you about the qualitative study. So I did 4 different focus groups. And each focus group focused on one group of, or one type of work type. So one was with registered nurses, one was with registered practical nurses, one was with PSWs, and finally one with key informants. So PSWs basically worked in long-term care facilities, most of them were. And also for the key informants, they were a good complement. And this was with my research team, we kind of discussed whom should we choose. So this was a little bit of, not necessarily a convenience sample, but it was based on merit, based on knowledge, and we invited those individuals. So we had people who worked in hospitals and disability management. We had people who represent the union in terms of ONA and QP for PSW, and also those who work in private rehab that basically could discuss their treatment with people who go on a sick leave. So there are basically 3 primary themes that came out of my research. So there's the organizational factors that impact employees. So that includes exposure, shift work, safety climate, and work support. The second theme was the job's impact on one's physical health with a specific interest in musculoskeletal disorders, and also the emotional toll on one's mental well-being. And this includes guilt and burnout and anxiety. Now, for the sake of time, I did not include every single finding in there, although it's very interesting, but I just brought some small pieces for us to look at together. So let's first look at exposure to infectious diseases. Now, it's really important to note that this was well before the coronavirus that I did the study. So this study was conducted in 2016, 2017. By the time we did the analysis and wrote the results and did everything, it's now just being published now. So it should be ready soon, fingers crossed. But basically, this, I found it very eye-opening looking at it now, well before the coronavirus. So let's read together what one person said about infectious diseases. Once one person gets sick, and especially in a long-term care home, it's like a daycare and everybody gets sick and the staff gets sick, and you know, staff come in sick anyways because they got to make a living and they just keep spreading, and it's very bad for the staff and the patient. I would bet, although we know that this is really important, I would bet that before the coronavirus, this may have not been seen as very significant. But when you look at it now, it's almost like foreshadowing. It's almost like it's telling you like this is something that is of concern. Now, when I spoke more and more with the staff, they actually mentioned that organizations and hospitals are doing a really good job adhering to the policies, which is washing your hands and wearing the mask when needed. But the issue that they said is patients don't necessarily do that because they might be very infectious, but they might go, for example, to the cafeteria within the hospital and get things. So on the way there and back is where risk could happen. So this was just an interesting finding that they talked about, but I just found this very, very significant now looking at it. Let's look at guilt. I just wanted to bring out a point in case someone's not familiar with this term, which is presenteeism. Presenteeism is attending the workplace, but you're basically not, you're physically there, but you're ill, so you're not performing as well. You should be home. So one of the themes that we found, or sub-themes that we found, is working while sick. So presenteeism because of guilt. So let's read this together again. Very, very powerful when you look at this now, and it makes you think, gee, I hope this is still not happening. I wasn't feeling well, but if I go home and just leave them short because I knew nobody's going to come in, so I felt bad leaving them short. And it was like a Saturday and it was very busy. So I had to stay. Do you see the guilt there? Someone who may not necessarily be feeling well is willing to stay because they don't want to keep their staff basically short or being understaffed. Looking at shift work, there's been a lot of comments on these, so I just kind of highlighted a couple of very powerful statements that will resonate with people. So obviously they mentioned the inability to recover, the commitments at home, feeling tired, the physical demand of the job, and also having to be alert. So they said it's almost like shaving it's like 7 years off your life. The safety climate and the work support and lack of debriefing was also a really big one, and they really talked about that. I remember one participant told me, she basically said, "Do you know why I came to your study?" And I said, "Why?" And she held out the gift card that I gave them as a token of my appreciation. It was only like $20 or $25, but she said, this shows that somebody cares. So that feeling of support is very important. And they're very passionate about their work. It's also, when we're talking about safety climate and what's considered safe and what's not, acceptance of abuse is a big one too. So it's one thing to actually experience the abuse, but the perception of others about that abuse is also very concerning. So when we read this one together, I've had police called in when a staff had been assaulted, and they said, well, it's a part of your job. So that gives the assumption to the public that nurses and healthcare aides and PSWs, it's a part of their job to be assaulted, and there's not much that can be done about it. Musculoskeletal pain. So I don't think this is shocking to anybody, but basically repetitive work, physical violence, and lack of recovery between shifts. Now, there was a lot of talk about basically age and experience. And this one really hit home, especially with what's going on with some of those long-term care facilities. They mentioned that a lot of times PSWs in particular, this may not be their first career, so it's their second or third career. So what happens is they may have had jobs where they have already had injuries, and they come into this job, and if they don't know the policies, or if they're kind of learning as they go, they may get hurt. So, they say that a young nurse, so someone younger in the field, may get hurt because of the inexperience, and an older nurse may not because they have the experience. But when you have the inexperience with older age, you may be more at risk. But here's another one too, is that sometimes PSWs, just because of the wages, they work in multiple sites, so they are basically exhausting themselves. And we're seeing the impact of that to some capacity with long-term care homes now, and the spread of the coronavirus. So this to me was also very powerful. The emotional toll on mental well-being, there was definitely a lot of those, but the one that stuck with me was basically witnessing the death of patients, especially of their children. Now, when we look at the demographics of nurses and healthcare aides, the average is usually around 40, and they're mostly like basically parents and mothers. So, they're just saying it's not just supposed to happen. And I recall one of the participants just talking about it because they worked in a pediatric facility. She was quite emotional, and rightfully so. There's also the fear of being asked to report to work when off duty. And this one is also a scary one, especially from a psychologist's perspective, in the sense that there's always that arousal within our brain, thinking that even when I'm supposed to be relaxing, I can't totally relax because I'm worried that they might call and say, we need you because we're short-staffed. So here are some kind of considerations based on what I had discussed. Now you will see here, as I mentioned, that it seems like staff shortage plays a big role. That is an underlying factor. So what we're seeing here on the surface, when someone's saying, I'm gonna go on a sick leave, we can identify that it's because, for example, musculoskeletal pain, or they have depression, but we don't know necessarily what happened before that to lead to that. And then we say, okay, it's musculoskeletal pain, but what led to that? So that's the important piece that my work kind of did. And it seems like staff shortage was a big factor. So working short, you're basically going to have a sick employee who's going to feel guilty. So they're going to work extended hours. They're going to have high demand. They're going to feel fatigue. They're going to be potentially exposed to violence or contaminants. They might have musculoskeletal pain, or they might feel burnt out. Then they're going to go on a sick leave. What does that lead to? It's going to lead to staff shortage, and that cycle goes on. Please consider another scenario where when you're working short, and then now when you do that, you have less time to recover. You are probably a little bit more stressed, and thus you might ignore your self-care needs. So when you're unable to have structure in your day, it's gonna be difficult to plan your meals, to exercise, to sleep properly, so on and so forth. And that's all because of shift work, and doing that and you're not recovered, and then you do repetitive work and so on, you might experience musculoskeletal pain, and then that could lead to sickness absenteeism, and then staff shortage, and the cycle goes back again. So here's the conceptual framework that I'm proposing based on our findings. Again, some of these are it's basically a concept. Now there are what we call direct and indirect factors. So direct factors is basically things that we can say that, okay, this is causing sickness absence. So if someone, for example, falls and gets hurt, that is basically a cause for sickness absence. This could happen in the workplace, or it may not be work specific. So someone gets in a car accident, or someone that maybe goes on a ski trip and hurts themselves, right? So then when we look at the indirect factors, the first level I would say is probably the initial antecedent that sometimes is not really seen, is staff shortage. Now you'll see on the left of this, there's a moderator, which is the increased work demand. So as that increases, the other levels increase as well. So traceable variables is basically the personal factors that we're talking about. So if you had other commitments, if you are, for example, new, you may not have the experience. Occupational factors may be that working night shift. Maybe you are feeling, a little bit burnt out, so on and so forth. It's going to show, that's going to take a toll, and it's a combination. So the traceable variables may not be one or two, it could be a combination of many. And obviously that increases with the increased work demand. And then it's going to present itself in either physical and psychological and emotional. And that would lead to the sickness absence. And obviously with sickness absence, that's going to increase the number of people who are, or it's basically going to increase the staff shortage. So that's basically the conceptual framework that I have for this. So future considerations, basically preventing sickness absenteeism, it's really difficult in a very dynamic workplace, right? So we're not robots, patients are unpredictable, so we cannot just say do this and then it will go away. So some things that we may do to help with the sickness absenteeism and the staff shortage is to adapt. So the first thing is, I believe there needs to be a new normal, and I think we've heard this a few times. So there should be better check-ins before you attend your shift. So it might be needed that you come in, temperatures have to be checked, maybe other vitals, just to make sure that you are healthy. And all symptoms should be taken seriously. Also modifying some policies when working short-staffed. So it seems like maybe this is something that we can't get around. So perhaps we need to determine what are some of the duties that I must do, and maybe things that could wait if someone is working as short-staffed. There needs to be some education on supports offered through the EFAP. This was kind of talked with the union, actually. They said, people are not utilizing it as much. So this would be a great opportunity just to learn what services that can be offered through your EAP or EFAP services that could help you, whether it's physical or psychological. And obviously, as I mentioned beginning, the takeaway from this is that work support could statistically, very powerfully reduce the odds of sickness absence. So this, I call on to all the leaders to increase, improve the work dynamic, have more frequent check-ins with your staff, and more on-time debrief. So they mentioned this too, like, I can't debrief, like when there's no debrief and something happens, that lingers. And they mentioned, for example, that, if someone gets hurt, they can't necessarily talk about it with their partners or family members because of confidentiality. So they have to hold this in. So debriefs about things and in a timely way would be really, really important. Open communication. If I'm comfortable enough to talk to my supervisor and say, look, I'm actually not feeling that well, or I'm starting to get hurt, then maybe there's some preventative measures that can be done. And also with that, if we can report the quicker reporting on physical pain before it develops to a full-on MSD, then maybe we can modify the work so they're not completely off and they feel like they have to work because of money. And at the same time, it will actually save a lot of money for the organization. So that basically concludes my presentation. So at this point, I'm going to turn this recording off, and I'm happy to join you live for Q&A. Thank you for your attendance.